Neck pain that can kill. Neck pain, red flags. This video is a sequel. It's more in the guise of Empire Strikes Back rather than Marvel Film 47 or whatever. I don't know how many they're up to. What are they up to? Someone died. Okay, where were we? It's about serious pathology neck pain causes today. That's red flags, which sounds boring until you realise that most of the radiation-causing scans you get referred for are completely unnecessary. This is for the people who are going to need them. I'm Stuart Cox, veteran physio, owner of Movement First. As I've said before, I'm all about the facts, evidence, no BS, proactive empowerment of people like you so you can learn the evidence when it comes to back and neck pain and do what you want with it. This video is going to go into the latest evidence. I will give you a completely free guide that synthesizes it and gives you something practical that you can use to see if you have significant risk of serious pathology of the spine when you have neck or back pain. Neck pain serious pathology causes are more poorly researched and understood than those for the lower back, and as a result a lot of the considerations and guidelines are merely adapted from low back pain risk studies, which some might call this lazy extrapolation. And it's strangely ironic that doctors and academics and clinicians like myself get upset when some influencer gives far too much weight to a certain, piece of research done in whack-a-ding-dong and people grew an extra muscle after consuming a diet of raw armadillo carcasses. I don't know. But what I'm saying is, if you've got some spare research grant dollars, you might want to spend it here because, hey, Bill and Melinda, we have gaps in the knowledge. Spinal malignancy. Okay. Neck cancer can impact any of the structures, bone, soft tissue, neurological. They don't look awesome and can be a sign of cancer somewhere else in the body as well. Symptoms and signs to look for can include history of any type of cancer, significant unexplained weight loss, pain at night when resting, being over 60 years of age. So, neck cancers represent less than 10% of all spinal metastases. So we're looking at really low percentages here, like fractions of a single percent prevalence in all clinical settings. It's quite rare. Neck fracture. Ooh, crack. Oh, they're not fractures. Neck fractures are a big deal due to the risk of spinal cord damage. So this is why whenever there is trauma to the neck and head, a scan is often done routinely just to eliminate serious pathologies. So especially when things happen like car accidents, falls or sporting injuries. Was there any major or significant trauma? So significant trauma tends to be marked as fall greater than 1 meter or 5 stairs, history of previous osteoporotic fractures, use of steroids or immunosuppressive drugs for greater than 3 months, 4 to 5.4% of a population of trauma patients had a neck fracture. The world age-adjusted incidence rate is 10.4 per 100,000 person years. Okay, the overall incidence rate of risk in the US is 5.2 per 100,000 person years. Person years is a common incidence rate term that reflects how long the participants were in a study, how many years, and how many people were in the study. So obviously much higher numbers, much higher risk. Degenerative cervical myelopathy. Say that one 10 times quickly. Okay, this is spinal cord compression. Think not enough space for the spinal cord due to age-related changes. Typical symptoms include neck or limb pain, weakness, sensory loss, loss of dexterity, tingling sensation, imbalance, falls, autonomic dysfunction like heart rate, blood pressure and digestion issues. Prevalence for this is estimated at about 2.3% of the total population. Though it can also be said that there are studies showing that this is far more common than we think, and getting missed in a lot of clinical settings. So people come in and report they have a little bit of funky sensations in their arms or legs or whatever. They're getting weird headaches or things like that. I'm particularly aware of this one at the moment. I'm, trying to implore that to a lot of junior physios and junior clinicians because, I reckon I would have missed some cases in years gone by that would have potentially been from myelopathy or that narrow spacing of the spinal cord due to degenerative changes. Nerve radiculopathy. What is that? That's a nerve root pathology. If you've got neck pain, but you've also got loss of power or sensations in the arm or in both arms, how often is this happening? Okay, 1.14 to 1.3% of the population. So you can see again, nerve root radiculopathy, like I mentioned in the previous video, there's often a component of pain with a lot of neck pain that is related to the nerves, but it's not necessarily always a red flag. Okay, let's move on to cervical artery pathology. What is this? Which means this very important vessel that lies in the neck has some type of issue. The three most common symptoms include dizziness or vertigo, headache, and neck pain. 2.97 cases per 100,000 people per year. This is from not that recent a study, but again, it gives you an idea that the odds of having this are pretty low, but use my spinal red flag checker, you can see whether you've got some sort of match-up symptoms there. Okay, infection. No one likes infections. Once again, there can be bacterial, fungal, viral, but these can affect the spinal cord, the vertebrae, the surrounding tissues. Could be from blood infections, trauma, come from other parts of the body, the same, or surgical procedures, the same things as with the back. Now, if you've got neck pain and you've got any of these symptoms, watch out. Fever or chills, pain at night or at rest, recent infection history, use of steroids or immunosuppressors, greater than 3 months, people with immune system disorders are more at risk of infections. IV drug usage. One significant study stated only 2.2 cases of infection per 100,000 people per year for the whole of the spine. So this is, again, a really low fraction. And of that whole spine, only 11% of those were for the cervical spine. The rest were all down here. Atlantoaxial subluxation. Crank, crank. What does this mean? It looks like this. You got these two vertebrae at the top of the spine, atlas and the axis. First vertebrae instability, which is not good given that you've got very important structures in behind there. It's looser than it should be, and it could be popping in and out. Doesn't sound good, does it? What are some of the signs and symptoms of people who have this? They have neck pain and stiffness, spasticity of muscles, sensation and weakness changes in the head, neck or arms. They've got breathing problems, dizziness or vertigo, headache, or even quadriplegia kind of symptoms. For research here, as atlantoaxial subluxation or instability was found to have a highly variable prevalence in the studies. One study says 4.6%, goes up to 40% in others in rheumatoid arthritis sufferers. Another recent study found that 7.2% of atlantoaxial instability cases overall are people with Down syndrome. So, if you have either of these two conditions, then your risks are significantly higher. Cervical structural abnormality or deformity is when you have things like this, some sort of malformation of the spine that's significant enough to cause issues. Signs of this can be pain, neurological deterioration, nerves that means, difficulty with horizontal gaze, dysphagia, which is trouble swallowing, and dyspnea, which is trouble breathing. This is really quite uncommon, with estimates of less than 0.2% of the entire population. So, low. Inflammatory arthritis is an often forgotten red flag. Now, back and neck pain can also be the sign of inflammatory disease, such as ankylosing spondylitis or psoriatic arthritis. Yet, one study found that many of these people almost suffer 5 years of these symptoms and pains before they're diagnosed, which is pretty poor. So, what do we really need to watch out for? Well, multiple joint aches and pains and stiffnesses, especially in the low back, the buttocks and the hips, which develop over weeks or months. You also want to be looking for pain, swelling, redness and warmth in toes, heels, ankles, knees, rib cage, upper spine, shoulders and neck. Stiffness when first waking up or after long periods of rest, right? So you're stiff when you've been at rest rather than stiff when you're warmed up. Back pain during the night or in the early morning. Fatigue, appetite loss. Prevalence, estimates are generally below 1% of the population for inflammatory arthritis of any part of the spine. For ankylosing spondylitis in the US, we're talking 0.2 to 0.5% of the entire population. For psoriatic arthritis, you're looking at approximately 0.06% to 0.25%, depending on your country and your ethnicity, which is quite interesting. Okay, that's a lot of heavy reading and data interpretation done, which hopefully gives you an idea of the signs and symptoms to be aware of, but ultimately it shows you the low likelihood that you have serious red flag pathology when you have neck or back pain. All the references that I've used for this are listed below, and they're also listed in my Spinal Risk Red Flag tool data. One thing I should mention is that it's a combination of signs and symptoms which increases your risk of having a serious pathology, and that's what I've tried to table in the Spinal Risk tool. If anyone wants to contact me about turning Spinal Risk into a digital app, well, let me know, as I am trying to make this happen as we speak for the benefit of you guys, clinicians, and health systems. It would be great to have something to go boop, 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 boop. Check out the current version in the link below, or go to movementfirst.org and find it there. It's free, once again, and I just hope it helps any of you in some way. Comment below and ask some questions, and hopefully I can be of assistance. If I can't, I'll try and push you onto someone else who's got better answers than I do. Thank you very much. Time for a coffee.